We'll get going here in just a sec. All right, and I see 1:15 straight up, so we will go ahead and get started. Welcome everybody to our weekly briefing on all things regarding the COVID-19 pandemic with the City of Bloomington, Monroe County, Indiana University, and Indiana University Health. I'm Chuck Carney, Director of Media Relations for Indiana University. We'll open up with some opening comments. First of all, we will start with Mayor John Hamilton.
Thanks a lot. Nice to be with you all. Chuck, thanks for covering last week. Appreciate that. Just the quick city updates I usually do. We do have 3 cases we reported this past week among our employees, positive tests. So our month of September is one of the highest months we've had all year overall. We're still at 63% of our employees who have reported their vaccinations to us. And I want to note this week, the City of Bloomington Utilities wastewater testing had 2 non-detects. That is the RNA, the presence of the virus was below the detectable limit. But we want to caution, because the day that's done over a 24-hour period, and the day it was done, that period had a high amount of rain. So actually, it's expected to be a little more diluted in that regard. For those who are really technical, I will report, yes, this is a wastewater system testing, but yes, rain events do affect the volume even in the wastewater system through infiltration and inflow, more than you need to know. But it's one of the reasons this is just one data point, and it can change based on various things. I don't have much to say today. I do appreciate the federal action from 2 weeks ago, as well as even today, and the work on the booster shot issues. For those who, after 6 months after their Pfizer shot, are over 65 or are in an at-risk medical status or at-risk professions, those recommendations of making that booster shot available are really important. I really do appreciate the federal leadership on helping try to move us forward. We will locally, I know, continue to take the key steps of masking, I hope, and of course, encouraging the vaccinations. Cooler weather, holidays coming do give us concern, give me concern, and we'll certainly pass it over to the experts here. But we are not out of the woods. It's really important not to get lackadaisical or complacent about this. Still in dangerous times. I know there are people in the hospital. We're losing Hoosiers every day, and I want to encourage everybody to stay the course as we watch the numbers very carefully, and happy to take any questions. Chuck, back to you.
Okay, let's check in with the Monroe County Department of Health and Public Information Officer Kathy Hewett.
Hi, good afternoon. Monroe County remains in the orange advisory level this week on the Indiana State Department of Health coronavirus dashboard. The weekly cases and the positivity rate rose slightly over last week's numbers, with this week having 204 cases and with the 7-day positivity rate being at 5.62. So the Monroe County Health Board met this Wednesday evening, and after reviewing the current data and hearing public comment, the board voted to request an extension of the current public health regulation until October 31st at midnight, unless it's repealed beforehand. The health regulation requires that when the Monroe County is in a COVID advisory category other than blue, that people in Monroe County shall wear a face covering while in a public place, with some exceptions. You can find more information about that health order on the Monroe County government website, and look on the red banner, and there's a link that will take you right to that order. The request for the extension is expected to go to the commissioners, and hopefully will be on the agenda for this week if you'd like to watch that and look at their vote. So as the mayor alluded to, the CDC did release interim guidance on the COVID-19 booster doses early this morning that allows for people at the highest risk for COVID-19 to receive a Pfizer COVID booster shot. CDC now recommends a booster dose of Pfizer for those who received the Pfizer vaccine as their original series and who fall in the high-risk groups. This booster must be given at least 6 months following their second dose. The CDC says that people 65 and older and residents in long-term care settings should receive a booster shot. People aged 50 to 64 with underlying medical conditions should receive a booster shot. And you can find more information on those applicable underlying medical conditions on the CDC coronavirus pages. People 18 to 49 with underlying medical conditions may receive a booster shot based on their individual benefits and risk. And people 18 to 64 who are at increased risk for COVID exposure and transmission because of their occupational or institutional setting may receive a booster shot. Again, these recommendations are for people who received the Pfizer vaccination only, and for booster shots are to be given at least 6 months after the second dose. Those who fit into these categories can attest to meeting the CDC guidelines, and no proof of eligibility will be required for them to get the booster. Eligible Hoosiers who want to obtain a booster can go to www.ourshot.in.gov and search for a site that has the Pfizer vaccine. You can find it on the website by looking for PVAX, or you can call 211 for assistance. You should remember your vaccination card, take it to the appointment to make sure your booster dose is added to the card. The CDC will continue to evaluate information as they receive it regarding recommendations for other groups of people, as well as for people who received the other COVID-19 vaccines. Additional doses of Moderna and Johnson & Johnson vaccines have not been approved at this time. Locally, our public health nurses have added additional vaccination days and hours to give COVID-19 vaccines at the Monroe County Public Health Clinic at 333 East Miller Drive. You can register for an appointment again by going to www.ourshot.in.gov. They will also have a public outreach vaccination clinic this week at the Hoosiers Outrun Cancer event on Saturday from 8 to 12, but they will only be given the Johnson & Johnson vaccine at that clinic. They continue to visit schools and are now offering both flu and COVID vaccine to eligible students. The State Department of Health is also hosting a COVID vaccine and testing site at the Indianapolis Motor Speedway that opened Tuesday and will go through October 30th. Both Pfizer and Johnson & Johnson vaccine will be available, as well as PCR and rapid antigen COVID testing. Flu vaccine will be available while supply lasts. Hours are from 12 to 8 p.m., and pre-registering for appointments is preferred. You can search for the IMS site on the www.ourshot.in.gov website by inputting the zip code 46222 in the search bar on the vaccine sites map on the page. And COVID vaccinations and testing also continues to be available at local stores, including CVS, Kroger, and Walmart. Information on these sites changes often, so we recommend that you check both the ISDH COVID vaccination and testing sites, as well as the individual store sites, to keep up to date on how to make the appointment, as well as what vaccine and tests are currently being offered at the stores. Even with the new news on the booster doses, we still need to remember that our primary goal remains to get everyone we can vaccinated in order to provide the best protection possible for our community. Our vaccine rate is now at 59.6 as of Wednesday. While having a vaccine rate of almost 60% is terrific, that means we still have slightly more than 40% of our eligible population not yet vaccinated, so we still have a ways to go. The Gravity COVID testing drive-through site that's being operated by the Indiana State Department of Health opened this week at 500 North Profile Parkway. This clinic is offering PCR testing and will be open Tuesday through Saturday, 8 a.m. to 4 p.m. This is an anterior nasal swab, and it's not the deep swab. Results are expected by 5 p.m. the day after the test. To schedule an appointment, go to the IDOH website at www.coronavirus.gov and click on the link that says Find a Testing Site. Then look for the list of testing sites by county and select Monroe County. This site is at the very top of the list, and it's labeled Cook Medical Parking Lot. Okay. That's all I have for today, and I'll be available for questions. Thank you.
Okay, let's check in with Monroe County Commissioners and Administrator Angie Purdy.
Hi there. Appreciate you guys having me today. I'm here because Commissioner Thomas is unable to attend the meeting today, as she and Commissioner Jones and Commissioner Gissens were asked to participate in an Indiana ADA Coordinators Consortium online conference for a topic of compassionate interlocal response to reducing and preventing eviction during this time of COVID. They're being joined by the Honorable Judge Stafford, members of CJAM, and Kim Alexander from Bloomington Township Trustee. As a reminder for our community, To receive alerts regarding the updated information from the health department, as well as emergency weather and road conditions, just go to our website, which is co.monroe.in.us, and click on the megaphone and sign up. It's free, and you can choose how you wish to be contacted: phone, text, and or email. And yeah, you can get it all of those 3 ways, and believe me, you will receive it all of those 3 ways. As long as the governor's emergency order remains in place, the county is offering assistance to county residents struggling to pay for basic necessities like utilities and rent due to the pandemic through the Township Assistance Fund. If you need assistance, please contact your township trustee. And remember, every resident of Monroe County lives in a township, whether you live in the city or a town or neither. And then you can find contact information in the minutes of the commissioners' meetings every week, or look on our website under the community tab, or you can call 211 or search Indiana 211 online. I believe the last thing I have for you is there are 2 upcoming blood drives, October 21st from 2 till 7 at the Southeast YMCA, and October 22nd from 10 to 3 at the Southeast YMCA. If you're interested in making a donation, please go to redcross.org to make that appointment. That's all I have to share with you today. Thank you.
Okay, let's check in with IU Health and Brian Shockney.
Good afternoon, everyone. I know that Allison Moore is not on this call, but Allison Moore is someone who's been with us for this period of time, and want to just call out her stellar leadership through this process. I know she's changed jobs and is no longer on this call with us, but I'm going to be sure that she knows she is respected. Thank you, Allison, if you're listening, for all that work. As this graph shows, our region is continuing to see a slow decline in COVID-19 patients in our South Central Region hospitals. This is good news. We look at these numbers daily, and we are cautiously optimistic that they will continue to decrease. It took about 6 weeks for us to see the decline to basic, kind of holding levels previously in our previous surge. So we're hopeful that we can quickly decline. The numbers here in Monroe County between IU Health and Monroe Hospital show the same pattern. And then, as you can see in the graphic we've been sharing, a large majority of our inpatients continue to be unvaccinated individuals, and our number of vaccinated COVID-19 inpatients in critical care or on a ventilator remain very low. While these are good signs, there's nowhere near the low rates we saw only a few short months ago in terms of the prevalence of COVID in our community. And we're still seeing people who are very sick from this COVID-19 virus. Critical care beds remain a point of concern across the country. And here in Indiana, they continue to hover around 20% availability. And we're still postponing needed surgeries and other procedures to ensure our resources are focused on caring for these very sick patients. One item we've been keeping a close eye on over the last few weeks is the CDC recommendation around boosters. And IU Health continues to follow CDC guidance for administering COVID-19 vaccinations. If individuals have questions about whether or not to get the additional dose, and if it's appropriate for you, we just ask that you talk to your primary care provider about it and be sure that they are on board and give you information. Our hospital operations have been getting a number of calls from members of the community asking when and where they can get their 3rd dose. The best information, as has been stated before, is on who is eligible for the 3rd dose is the CDC website, and it's in the chat. And now that we have a decision from the CDC, the Indiana Department of Health is going to work with vaccine providers across the state to ensure we're supporting our communities just as we did when the vaccines first became available. So those who fit the CDC criteria should visit ourshot.in.gov for available locations in our community providing the COVID-19 vaccine. And don't forget to take your vaccine card with you. That will be important. Lastly, I'd like to wish everyone who is participating in tomorrow's Hoosiers Outrun Cancer a safe and fun day. Thank you to Cancer Support Community and Bloomington Health Foundation, all the other organizations that have organized this great event. While we're fighting COVID, cancer is one that we have been fighting for many years and continue to seek a cure. IU Health is a proud sponsor of this great event. I'm happy to take questions at the end.
Okay, let's next check in with the status at Indiana University. Kirk White not here this week, but our Chief Health Officer, Dr. Erin Carroll, is here. Erin.
Thank you. It's a pleasure to be here. I'm going to try to be brief just because I think we can get to questions, but I think what we're seeing at IU Bloomington mirrors what everyone has been talking about in general. This week, as the dashboard was updated, there were 62 cases of COVID on IU Bloomington's amongst all of our constituents, 49 amongst students and 13 amongst faculty and staff. Those are pretty low numbers. The vast majority of them are symptomatic. We're still doing a lot more symptomatic testing than we did at almost any time last year. The vast majority of people who are tested, however, do not have COVID. There's a lot of other viruses going around, and in a vaccinated population, when people are sick, it turns out that it's more often not COVID than COVID. So we're continuing to remain vigilant. Nothing has really changed. Clearly, the mask mandate appears to be continuing, but is in effect right now. We are continuing with our asymptomatic testing programs of those who are unvaccinated, as well as ubiquitous and available symptomatic and voluntary testing for anyone who wants it. But things are significantly better this week compared to last week, and still remaining quite low compared to where they were certainly at this time last year. And vaccination works. We hope that the rest of the state joins us at the levels that we're enjoying right now at IU, and we're continuing to try to push those higher.
Okay, happy to take your questions. I don't have one in the chat at the moment, but I know that there will be some that will be coming. So we will get to those when I do see that. Erin, because you have to live with me on this sort of thing, I'll just come back to you first and start more of the discussion. So I asked you this on the webinar actually the other day, and I'll ask it here because some of those questions came in from the community. There was some discussion about, we had a full stadium with people for the football game last Saturday, and there's not a mask requirement for an outdoor event like that. Any concerns with that, and why no mask requirement there?
Well, in general, outdoor events tend to be very safe when it comes to COVID. Throughout the pandemic, there have been very few large-scale transmission events when they occur outdoors. Of course, what we are much more concerned about is all of the events that go on in conjunction with a large outdoor event. More people gathering in bars, in restaurants, and large indoor gatherings and parties. That's where transmission is much more likely to occur. Of course, if we're being very honest, those things all occur whether or not we have a football game. Parties are going to occur, bars are full, restaurants are full, large indoor gatherings are occurring. And so we continue our vigilance and talking to all of our constituents, especially our students, about being careful in those extra settings, regardless of whether there are large outdoor events. Having said that, if people want a mask, we certainly encourage that. And if people are worried about keeping themselves safe, quality of mask matters. Surgical mask is better than a cloth mask. K95 mask is likely better than a surgical mask. And people who are concerned are certainly welcome to wear a mask when they attend a football game. But in general, again, our population is very vaccinated. It is an outdoor event. It's considered very safe. And we are monitoring what has happened after the first two home football games. And as I said, our cases were actually much lower this week after the second game than they were previously for the rest of the month of August and September. So we're still continuing to watch, but in general, outdoor events like that are very safe, and masks are generally not required.
Okay. Question from Patrick McGurr at the Herald Times. Is anyone from the city or county aware of an announcement that more testing might be coming to the area through a company called COVID Clinic? Kathy or Mayor Hamilton or Angie?
I'm not aware of that.
I am not aware of this company as well.
Okay. All right, so the answer to that, no. From Dave Askins, the B Square Beacon, for anyone, it seems like one of the psychological barriers for someone getting vaccinated now after waiting so long is that it might feel like an admission that up to now they've been wrong. Nobody likes to admit that they're wrong. What are your ideas for encouraging people to get vaccinated that give them some kind of out that doesn't feel like an admission that they've been wrong up to now? Erin, this sounds like one that we
I'm
would get.
happy to jump in. I didn't want to, hog all the questions. So first of all, I would encourage them to get over that this is not, there's no reason to be right. We all just want to be happy here. Everyone will be safer if they get vaccinated. If you need an excuse, much more recently, I think you could point to recent data and seeing that the hospitals are still filling up, that things are still very dangerous. The Delta is even more infectious than we had, previously seen with other variants. And so the danger is, the likelihood you're going to get infected is higher now than it was before. And so maybe now the risk threshold is past your level of comfort in order to get vaccinated. I think you could also point to the fact that vaccines have now been approved. We have even more safety data than we did in the past. We have even more evidence that these are incredibly good at preventing the bad outcomes that we're worried about: hospitalization, death, ICU stay, anything else. And given that increased level of evidence and increased level of safety, that even someone who was on the fence before could now feel much more comfortable that this is the right decision.
Also say that you're not wrong, you're enlightened. And so that's, more data, as Dr. Carroll said, more data and information. I do want to tell a story. So we did have, through our shot clinics and then, 91,000+ vaccines that we gave, we had an individual who, she came and got her shot, but she was fearful because her husband was not supportive of and did not believe that a vaccine was necessary. I say that because it is a very confidential process. So, we follow all the HIPAA guidelines, and if you would come to get a vaccine, no one would know but you. Everyone who is there keeps very confidential. Even if it's your neighbor, they are sworn, to secrecy. They cannot tell by law, and if they saw you there. So it's a very confidential process, a very easy process. And as we go forward, we would just encourage you to think about that. From you can do it, and you don't have to admit to anyone that you got your shot. We'll give it to you and never say another word.
I would just add too, just because you change your mind doesn't mean you were wrong, or doesn't mean, there could be new evidence. But even if you change your mind because you decide you're wrong, I just want to remind all the reporters that as a politician, that can happen too. You change your mind, doesn't mean you're wrong, or if it does, it's okay. Lots of us make mistakes, and I remember CDC Director Walensky, I think it was, who said it, I think it was she, who just said this virus makes us humble. We just have to be humble about this. So learning, changing, paying attention is we got lots of evidence where we've all had to change approaches. So
exactly. The more we learn, the more we need to change things to keep up with the virus. So getting the vaccine is definitely a good thing to do. And changing your mind's a good thing sometimes. So
yeah.
So questions throw out here, and Brian, this may be directed best to you. How will the vaccine be distributed when kids 5 through 11 are eligible? Would it be a community site like we've had in the spring, pediatrician's office, pharmacies?
So all of the above. So currently at our Miller Drive location, we are giving vaccines to those who qualify. So those that are 12 years old and above. And we have a drive-through testing clinic there as well for our pediatrics, and it's helping the schools and parents get their kids back to school quickly and get them vaccinated. We also, in partnership with the health department, are going into all of the community schools in our regions and providing vaccine clinics on a regular basis. So talking about changing your mind, if a family, it's a student or a parent, the first time around has said, no, I'm not sure I want my child to get the vaccine, we're back in the schools again another time, and they can get that vaccine then. So yes, we have vaccine at several sites, but so will Kroger and CVS and others. So there are that government site we cited previously, My Shot. Go there, and there's lots of postings of where you can go and sign up and get your vaccine.
Okay, happy to take another question or two here. One thing I will mention, Erin, we have been encouraging the flu vaccine. And in fact, tomorrow at 12 to 6 at Simon Scott Assembly Hall, you can get your shot there. We're encouraging IU faculty, staff, and students to get the flu vaccine. So that speaking to the need for it, Dr. Carroll, you want to speak to why we're trying to encourage it this year? And last year we required it when we had no vaccine for coronavirus, but now encouraging it this year and having these clinics starting tomorrow.
Well, the two major reasons are, first of all, while it's very difficult to require something that is not free, and while the COVID vaccine is free for everyone in the United States, the influenza vaccine is not. I wish it were. Federal government paying attention, please feel free. Regardless, of course, anyone who has any kind of insurance at all most likely has it covered, and it is easy to get a flu shot. It's so many locations, almost any drugstore, Target, lots of places. It's very easy to get a flu shot. But for those of our constituents who are under or uninsured, it is not free, and it is hard to require something that is free. That's one of the reasons why we're still hosting clinics, especially on the Bloomington campus, where any one of our students, faculty, and staff can get a flu shot free of charge. We would bill insurance, of course, if they have it, but if they do not, we want to get everybody vaccinated. So we are strongly encouraging it as much as we can. The other reason was last year we decided we would require it and yet then provide it. And we wound up buying a lot of vaccine that we could not use because people got flu shots elsewhere, which is wasteful. And we don't want to contribute to waste. We don't want to buy shots that could go somewhere else and then not use them. So this year, we're just recommending it as strongly as we can, really trying to push people as fast as they can to get to any site where they can get a flu shot. I've already gotten mine. And then to offer it in a variety of clinics throughout the fall to make sure that any one of our constituents who wants to get it and might have any difficulty can come get it on Bloomington's campus. And so our first clinic, as Chuck said, is coming up. We've had many people sign up already. We'll be doing that a number of times throughout the semester.
Yeah, and we have two others scheduled at this moment, October 12th and October 24th, those all at Assembly Hall for IU faculty, staff, and students. So we are light on questions today, so we may be letting our panelists off easy. But we may, well, just as I said, that Patrick, I said the magic words, and Patrick has a question in. He apologizes for getting one in under the wire, but here we go. For everybody, are we seeing more or less enthusiasm for other vaccines like the flu shot due to the experience with the pandemic? Are some people against the COVID vaccine now fearful of other vaccines, while people with a positive opinion of the COVID vaccine might be more likely to get one? Brian, you seeing any of that? Erin?
I'll go. I mean, I think it's too early to tell. I hear both sides of that argument. I think part of it is we're going to have to see how things go. We're certainly going to push for as many people to take the flu vaccine as we can, and certainly more people, I think, last fall took it than would usually take it. And I hope people have also learned the value of vaccination in general, and that there are more of those people than there are people who have now become really afraid of vaccination. But clearly, both types of people are going to exist. I think we're going to have to just wait and see what happens.
Yeah, Brian, any evidence of that you're seeing?
No, again, it's too early to tell, but I will say that if there's a positive side to everything, and we've been trying to find the positives in this pandemic, and I think one of them is the education to the communities and public and to the world about vaccines, how they're made, how they work in the human body, what they do, and how they protect us. And so my hope is that we will see a higher than normal vaccine rate for the seasonal flu, because we do have people die in our hospitals every year from the seasonal flu. And so the flu vaccine is just as important as the COVID-19 vaccine this year, as well as it is every year. And so my hope with all the education in new knowledge that we have that maybe most of us didn't have. I know I have learned a great deal through this pandemic about vaccines and how they protect us and their effect on our population and helping those who are most vulnerable live a full life. I'm hopeful that that will carry over into the other vaccines that we give to patients every day.
Okay. Well, seeing no other questions, we will go ahead and wrap it up there. We will be back again next week at 1:15 and talk about all things COVID-19 in the area. Thanks for your questions today, and we will see you then.
Thank you.
Thanks,
you.
everybody. Have a good week.